Well, I am Emin Kansu, ISA Chair of Council, and today we have a very distinguished scientist from Israel, Professor Chaim Hershko, who has been in ISH for many, many years, and I knew him for more than 30 years. And we are very fortunate to have him in Turkey in an educational meeting, ISH TSH School of Hematology. So he was kind enough to accept our invitation to have some talk and conversation about ISH. Professor Hershko, welcome. Welcome
Thank you
to
very
Antalya.
much. It's a pleasure to be back to Turkey. And Antalya is a special, beautiful place.
Thank you. And as I remember, you were really one of the founders and also very sincere supporters of ISH for many years.
Supporter, yes. Founders, I have to specify.
Okay. Okay.
I started my training in hematology in 1967 with the late Professor Gabi Isaac, who was a very good friend of Professor Orhan Ulutin. So I heard about Ulutin starting 1967, and then on several occasions he visited us, and I met him also personally. The ISH was founded, I looked up the detail, by Professor Joe Hill in 1946. So at that time I was still in elementary school. I am not a founding member, but it has developed very fast, and it incorporated representatives of different countries. And this is up to today, to my best knowledge, this is the basic difference between ISH and let's say ASH or IHA, because in ISH countries were represented usually by the president of the respective society from that country. So Professor Ulutin, he has become full professor in 1966, and the Turkish Society of Hematology was formally founded in 1967. So he was a founding member.
Founding member, yes.
And in Israel it's different. We had our presidents were replaced every couple of years, but Gabi Isaac was the dominant hematologist. Now there was a group of important hematologists from various nations at that time. Ulutin from Turkey, Isaac from Israel, and Astardi from Pavia, and Elio Poli from Milano, and also not so active, but they were also elected as national representatives of this group. It was called the Mediterranean Blood Club.
Yes, yes,
you remember?
Yes, yes.
He had the name for everything.
Yes.
Professor Fessas from Greece, who was ready to join us, but was not very active. He didn't travel very easily. And later, Professor Bishlawi. So this is the group of the Mediterranean Blood Club, and we had the meetings with hundreds of attendants, but these were national. At the same time, in ISH, this group represented joint interests. So, and then Ulutin always explained to me how important it is that they are national representatives, because otherwise some countries will never get a chance to be heard or to contribute seriously to the program. This is the story. Now, I personally trained with Gabi Isaac, and very fast I have become his right hand.
Right hand.
So it is very similar to the situation with you and Ulutin, Gabi Isaac, and myself. I was first secretary, not officially, but we were traveling together. Sure. And then I replaced him when the right time came. So this is the story. Now, our personal friendship goes back to the first days of my acquaintance with Ulutin, because you knew Ulutin on your side, and we met at these Mediterranean meetings, and then some very important meetings in which they were presidents, respectively. For instance, the ISH meeting in Istanbul, where you were the organizer.
Right.
And then we met, and after that, many other times.
Thank you.
So this is more or less the exact details.
Right.
Now, related to the contents, there is really a very special aspect to this on the personal level, because we became very close friends, personally, and also in our common interest in hematological problems.
Yes. Professor Hershko, thank you very much. This was a very nice insight into the society. Now, again, you and I experienced many times the mission of ISH, because ISH mission is really educate countries which need education, such as Africa, Latin America, Far East, like Vietnam, Bangkok, Cambodia, and other Philippines, in India and Pakistan. But of course, ASH and EHA is much more focused societies, because they are focused either in European education or North American and Canadian education with international
So we are the international.
Right.
With
Would you
more
tell
commitment.
us more commitment? Yeah.
To help
Would you
others.
tell us a few things about this vision? Because we, Sabri, and other secretaries always focus on this global education and hematology education.
Yes.
Of course, we respect science very highly, but still our education mission is most important. Could you tell us a few words about how important this mission is?
I think it's critically important, and this was not the original reason for setting up our group. But nowadays, and I think that the present meeting was a very good illustration of spreading education to other countries.
Right.
And this should be continued. This really creates a level of expertise that can be passed on to others, really with focus on education.
Education. Right.
And
Thank
it
you.
was very well done today and
in,
yesterday.
in the school.
Right.
In the school.
And not so difficult, because it's really in a few days of sitting down with young people, and I was very pleasantly surprised by the standards of the lecturers, young, without difference in gender. In fact, nowadays, the most exceptional lecturers are female, because they have a special talent for the hematology laboratory.
Also, yes.
Very good. And molecular biology.
Right. And the last few words about what is the future of hematology with this genomic age? What do you think as a very senior experience?
As a very senior scientist, I think there is no replacement for the human factor. And I'm speaking from my own experience. I enjoy my work today more than ever in the past.
Very good.
Because I'm no longer involved in administration. I'm not telling other people what to do or worrying about the things that other people should not have done, but minding my own business and cultivating my personal relations with my patients. Right. I'm now consultant in the clinical hematology for 500 physicians, family doctors, general practitioners in Jerusalem. And I do it at the official level, so they are entitled to send me patients. And they don't have to pay me for that. I'm employed by the health provider. And I also have the privilege of phone consultations.
Excellent.
So the way I do it, any physician has my phone number, the mobile phone number, can call me up at home, or there were specified hours, but now I let them call me whenever they want, so they don't hesitate. And then they say, look here, I have a young patient with anemia, don't know what to do with him. And then I have a list of tests that I recommended to do before the patient comes to me. And next week he comes, I have on the computer already the results.
Excellent.
And do the first phase, give advice, invite him for checkup to find out if that advice was appropriate or not. And this is the work I'm doing now. I have patients who have been with me for 20 years or more, from the foundation of ISA.
From the foundation.
These are ambulatory patients.
Ambulatory
so there are some thalassemia traits. The chronic patients are CLL, stage 0, essential thrombocytosis and so forth, MDS. And the most important aspect of my work is not what I do, but what I say. Because in many conditions, you have to reassure the patient. What can you do with CLL who doesn't need treatment, doesn't need intervention?
Exactly.
But he does need somebody who takes the responsibility. And I think this is the future of a part of hematology. This is not all of hematology, because there will be still the tertiary hospitals working very hard, trying to cure people. But there are lots of other people who do have chronic problems or acute problems or pseudo problems, like, false diagnosis of thrombocytopenia because of EDTA artifact.
Right.
Or iron deficiency, that you have to take a good history and you discover right away that this is a gynecological problem. Or autoimmune gastritis. So you can do beautiful diagnosis. The only regret I have is that I don't have time to teach. So, because I would like to explain somebody what I'm doing, and maybe I'm doing it wrong. So get a feedback also. But I think that ambulatory hematology is a field which can be easily developed, and in this we can give consultation free to for many others and cultivate this kind of community.
Well, Dr. Hershko, thank you so much for sparing your time and coming and giving us very good advice. And we wish you a happy new year and good health with Rina. Have a good time. Thank you.
It's always a pleasure for me to visit Turkey. Because of my Hungarian background, so I understand you better. The Turks, they taught the Hungarians to use paprika, and also the tulips.
Tulips, yes. Tulips, yes. We were there for many years, and we know Hungary so well, and we like them very much. Thank you very much again. Have a happy new year. Thank you.